Hi, my name is Alicia Yogi. Today's date is January 17th, 2021. Time is 8:51. Today we're going to be discussing a few different things. The difference between anatomy and physiology, the anatomical position, and the importance of the anatomical position, anatomical directional terms, and the anatomical regions of the body. Anatomy is the study of the body structure, and physiology is the parts, or the way the parts function together. Anatomical position is any region or part of the body in a specific stance, like this. In an anatomical position, the body is upright, directly facing the observer. Feet are flat and directed forward. Upper limbs at the side of the body with the palms facing forward. And the importance of this position is a method of terminology for medical staff to actually help with communication to pinpoint structures and describing locations. Anatomical directional terms, we have superior, which is above or higher, inferior, below or lower, anterior would be toward the front, or ventral, same thing, toward the front. Posterior would be dorsal, towards the back. Medial, towards the midline, so towards down the middle of the body. Lateral, away from the midline, so towards the side of the body. Internal or deep within, or interior to. External, which is outside. Superficial would be towards the surface. Central, the main part. Peripheral is extending from the main part. Distal is further from the origin. Proximal would be closer to the origin. Parietal is pertaining to the wall of the cavity, and visceral pertaining to the organs within the cavity. Next would be the anatomical regions of the body. So we'll start from top to bottom. Head would be cephalic, cervical, neck, cranial would be the skull, frontal, forehead, nasal, nose, occipital, the base of the skull, oral, mouth, orbital, eyes or eye socket, the buccal, cheeks, mental would be the chin, facial, face, and otic, ears. Thorax region would be axillary, which would be your armpit, costal, ribs, deltoid, shoulder, mammary, breast, pectoral, the chest area. Scapular would be your shoulder blade back here, sternal, your breastbone, and vertebral would be the backbone. Abdominal region, we have abdominal, which is abdomen, gluteal, buttocks. Inguinal would be the bend of the hip. Lumbar is the lower back region. Pelvic is the area between the hip bones, so in this area right here. Pubic, genital area. Sacral, which would be the end of the vertebral column, and then umbilical, navel, coxa, hip. Upper extremity, we have the antebrachial, the forearm, the antecubital inner elbow, and the brachial upper arm. Carpal are your wrist. Cubital, again, is the elbow. Digital are your fingers and toes. Manual would be your hands. Palmar, palms. Pollex, thumb. And now we're going to start on the lower extremity. Crural would be the shin or the front of the lower leg. Femoral, thigh. Patellar would be the front of the knee. Pedal, foot. And then plantar would be the arch of the foot. Popliteal, the back of the knee. Sural would be the calf or the back of the leg. Tarsal, your ankles. Hallux, big toe. Dorsum, top of the foot. And that's it.